Hello everyone and welcome into another video. We are Ryan and Megan, two travel physical therapists who really enjoy this lifestyle and hope to share our experiences with you. Today we are going over what to expect in a travel contract interview. So let's jump into it.
So as a new traveler, sometimes it can be intimidating coming into the interview process. It's just hard to know what to expect as a traveler because the whole traveling world is very different from the permanent world. And especially if you're a new grad, you've been taught how to interview really well and stand out to these jobs that you are seeking after. Now, in the case of a travel therapy contract, what's going to happen is you'll be talking with your recruiter, you'll find a contract that you like and you want to be submitted for. You'll get submitted and then hopefully you get an interview. And interviews are usually over the phone and there's usually a set time frame that the call is going to happen from. And this interview period is actually a chance for you to ask questions about the facility. It's a whole role reversal in the travel therapy world.
Yeah, and the reason why is because the employer at this facility is needing a traveler. So they're needing someone to fill a gap. Maybe they're low on staff. Maybe they're growing so quickly that they have too many patients to be seen and not enough clinicians. And so really they have a need for a therapist to come in and work that job. Mm-hmm. And so really they are hoping that you'll work there. And so this is a time where now you kind of get to interview them. Now, does that mean they're not going to ask you the fun questions of tell us about yourself, tell us your experience? They're still going to ask those interview questions, but they might not be as pointed or difficult as like a permanent job where they're really checking all their people because they don't necessarily need someone right away, and that's not very time sensitive, so they can take their time, comb through some candidates, and then pick the very best one. With the travel world, they're needing you there, usually ASAP, and so they're more willing to do the interview for you to ask questions about them and learn as much as you can before you decide if you want to go to that facility and work for them.
Exactly. This is what we've run into almost 100% of the time when it comes to interviews for travel therapy contracts. I think Ryan has had one interview that was very challenging. They asked a lot of hard-hitting questions, but really all of the other ones.
And that contract was because that was the first time they had ever thought about hiring a traveler.
Yeah.
And so a lot of these places that you go, maybe they've had travelers before, it'll really feel laid back. Really, they're there on the interview with you to answer any questions you might have about their facility.
Yes, so it's best to come prepared, yes, to know how to introduce yourself, and yes, to share your experience, but it's really better to be prepared with the important questions on their facility and what you're willing to step into and work in.
Now, before we hop into the questions that Megan and I like to ask when we are interviewing for a travel contract, I will say that we have a lot of students ask us, hey, this is my first travel contract. I'm coming right out of school as a new grad. What do I do if they ask me about what experience do I have? Mm-hmm. And our biggest answer to that is tell them about your clinical experiences. You did those for a reason. You were working as a therapist. I know you're working and training as a student, but you had a lot of good experiences there. I know for our program, we did 40 weeks of clinicals, and Megan and I tried to do them in a bunch of different settings because we knew we wanted to start travel therapy as new grads. So when we interviewed for that first contract, we elaborated on our experiences in those clinicals. And then we got to ask these fun questions that we're going to go over next to learn more about the facility.
Yes. So take a load off, take a sigh of relief. The interview is going to be okay. You'll get through it, and it will actually help you determine whether you think that this is a good fit for you at your first travel contract, because you want to walk into it confident, knowing that you're going to feel comfortable. So this is your time to feel it out.
So you're probably wondering what is so important to ask while on this interview. And so we're going to go over kind of our top 5 categories that we like to run through while we're on the interview to find out if we like this facility, if we like where we're going or not. So our first category is productivity. So you're going to ask, what is their productivity standards? How do they determine that? Is that like so many patients per day, so many points per day, minutes? So figuring out how do they calculate their productivity. And then we like to always ask, what is your expectation for productivity once we are kind of up to full capacity or seeing the full amount of patients?
The next category we'd like to cover in the interview is support staff. So this can be a big category because it's who you're going to be potentially spending your time with or who you're not going to be spending your time with. So it's nice to know, are there other therapists there? Are there assistants that you're going to be supervising? What is their experience level in the clinic?
Other clinicians that you will maybe interact with, so doctors, nurses. I know that's a big one for home health, which is what we like to work, who we're going to be interacting with there. As a new grad looking for that first contract, knowing is there seasoned clinicians in the facility that you can bounce questions off of while you're kind of getting your feet wet in the field. We always like to hear, is there clinicians working there 5 years or more? Because that makes us feel a little bit better because they have a little more experience than us. And then you also are finding out, are you the only physical therapist or occupational therapist there at the facility? And then as a new grad, that might be something you want to think about because you won't have any support around you with your particular discipline.
Yes, so this can be a huge question because as a new grad, you can basically find out through this category whether or not you should take this job. We made sure that we didn't take a first job that didn't have any support staff because we wanted to feel comfortable. We wanted to feel like there was going to be resources around us to help us be successful. So for us, it was a no-go if there were no other therapists around. And that's what we recommend for other new grads. Everyone's comfort level is different, but that's why this category is important.
And if you're really big into wanting mentorship, especially early on, then this is the question there you kind of ask about that, where it's like, okay, you have other therapists there. Are they willing to take questions? Do you have any mentorship? What would that look like? Get the details so you know, because every place is going to tell you, oh yeah, we have mentorship, but what does their mentorship program look like? Is it just that you can ask questions to the therapist? Is it that for 1 hour each week that you get to treat with them or shadow them? So kind of find out those details, but this is that time in the interview where if you're looking for mentorship, now's the time to ask.
Now on to category 3. Category 3 for us is asking about the orientation process. How are they going to onboard you? Are they going to give you a week to train? Are they going to give you a day to train? This is a big question because it helps you mentally prepare for what you're going to have to be ready to do. And if you don't want to take it on, like if it's a 1-day training process and you think, yeah, I don't know about that, then you don't have to take the contract. And this was a really helpful question. So orientation, you want to ask questions like, are there going to be therapists that you shadow while you're training? Do you get specific time to train with the documentation system? How long is the training going to last?
What is your ramp up period?
What's your ramp up? Are they
for patients? Yeah.
Yeah. So with patients, are they going to want you to be at 100% capacity within the first week, within the first 3 days? What does that look like?
Yeah. The key here is getting the details because we've had orientations from lasting only 2 days to orientations that have lasted 2 weeks, and they can be very different. Sometimes you just need a few days to hop in because they do such a good job and they're so organized with, like, one day you're doing the documentation system, another day you're kind of working with the therapist, you do a half day and then you go a full day, and sometimes you feel ready for that. And other times it's a little less organized, but they need a longer amount of time. So you just got to ask those details really to find out kind of what their orientation process looks like.
We've also found that in the inpatient setting, sometimes the orientation can be longer and maybe should be longer if they're wanting you to float onto different floors. Especially depending on the size of the hospital, this could be a big deal. If they want you to float between 8 floors and be ready to do it in 2 days, that could be a lot. So that's just a little tip to look for.
Our fourth category is documentation. And so typically we like to ask, what documentation system do you use? Part of it is we're hoping like they've used one that we've already used on a previous contract, but finding out what do they use, what does that kind of entail? Do they have scheduled doc time like within your work day, or is it just kind of point of care service where you have to do all your documentation with the patient?
Okay, and moving on to category 5, we call this one the nitty-gritty because there are a lot of details, just small little things that you'll want to know to make your process of starting this contract easier. So the first one is, how much time are you going to have with the patients during various treatment types? That means evaluations, treatments, reassessments, discharges. How much time do they allot for those types of appointments? Other ones are just very practical, like what is the dress code and what hours do they want you to cover?
Yeah, is it like 410s, 5/8s? Do you have to work weekends? So finding those things out before you sign on that dotted line.
This category could also include if you're looking for housing in the area. So if you want to know, have you had other travelers before and where did they live? If they know that, they may not, but if they have a lot of travelers in, they might have some good resources for you.
Another one that I would add in there is, are you going to be following the patient throughout their episode of care? Or as a therapist, are you just going to be doing evaluations, reassessments, and then discharges? And so different facilities operate differently. And so sometimes they have their physical therapists just doing those evals, reassessments, and discharges, and then their assistants doing all this, the normal treatments. And so you don't actually do your daily treatments. So that's a good question to ask to find out.
Yeah, you could also ask about the equipment that they have available, especially in the home health setting. What are they going to provide you with? Because all the equipment has to be with you and in the car.
That kind of wraps up our 5 categories that we usually like to go through. And then we always like to top our interview off with a little cherry on top, a kind of bonus question. And that is, how can I be the best traveler for you? Kind of find out what their expectations are for a traveler coming in to fill their position.
Yes, this helps you stand out. It shows them that you're willing to work hard for them and help them out while they are needing the help. And it does give you an insight into what's most important to the company for you to be fulfilling as their traveler.
We hope that you enjoyed this video. If you did, please hit that like button, share it with a friend, share it with a classmate. Hit our subscribe button if you want to follow and get more travel therapy content. If you have any questions, feel free to comment down below in the comment section. We love reading those and interacting with you. If you're new to the travel world or you're just needing some recommendations for travel recruiters, then feel free to email us at ryanandmeganorear@gmail.com. We'll go ahead and put that down in the description also, and then we can share with you the recruiters that we personally use and trust.
Also, if you would like, we have created a printable PDF of our top 10 interview questions that you can download just to have a reference for when you go to interview for a contract. So that will be in a link down below in the description. And thank you so much for joining us on today's video. We really appreciate having you guys here. We love hearing from you. And until next time,
See ya.